Drug addicts used to be in the shadows. Now with federal government policies, they're on every street corner. Whether you're in a city, whether you're in a small town, I've seen it across Canada. They are shooting up out in the street. And as the minister responsible said, we are saving lives. We want to have free drugs going out. Well, Brian Lilley writes for the Toronto Sun, and he has a different view, I think. I've read your columns on this. Do you think that the policy of having free, good drugs out there is working?
No, and the numbers show it's not working. Look.
Numbers of deaths.
Number of deaths. And we'll just look at British Columbia for a minute, because BC is at the forefront of this. And BC was ground zero for we need safe injection sites. Right. Safe injection sites will stop overdoses. We need them now. And my view was always, okay, if you pair it with treatment, I might come along. Nobody ever paired it with treatment. They just brought in safe injection sites. And we watched the number of overdose deaths in British Columbia, the whole province, go from 270 in 2012 to 2,272 last year.
And that's just a death. That doesn't measure the number of addicts, which is increasing.
The number of people going to hospitals, the number of people having issues with health otherwise. So all of that has grown almost tenfold. And now we're saying, okay, now we've got to give them safe supply. And we find out that safe supply, which means you give somebody a prescription and they get a prescription for a pill that's still an opioid, that is powerful as heroin, but it's not heroin, it's clean. Well, that's being sold on the streets for sometimes as little as $1 a pill, and it's going to kids. And you raise this issue and you say, this is a problem. Not just me, but doctors who are in favor of harm reduction are saying, hold on a minute, we have an issue here. Why are you against science? That's the answer from the government. Every question you raise with them saying, this isn't working. Why are you against science? Well, your science is killing almost 10 times as many people. There's a problem here.
So why is this happening? I mean, Bennett just about had a coronary in the House saying we're saving lives. But I think a number of people are now saying, you know what, there's different answers for different cases. There's not one answer fits all drug addicts.
Look, there's 4 pillars of drug policy when you speak to the drug policy experts. And these are people that believe in safer supply and harm reduction. And they say they are prevention, enforcement, which means law enforcement, and those two things cut down on the number of people using. So you convince people don't start, you enforce the laws so that you stop the supply from getting into the country. Then there's harm reduction, where you try and keep people alive long enough to get treatment, then you get treatment. We've forgotten about treatment, we've forgotten about law enforcement, we've forgotten about prevention. We're just doing harm reduction in a way where we open up the drug supply and we say, all right, everyone, shoot up if you got them, and we're not doing anything else. That's not a good answer. We need something better than this, and we're not getting it, and anyone who questions is called a science denier.
Well put. 3 minutes. Justin Trudeau is now on the record as saying that social media is destabilizing, and he wants to bring in censorship to determine what can be put on and not on social media. That is wrong. Please support this station, and please add your address so I can write you a letter and thank you for supporting freedom of speech.